The healthcare we provide for children is increasingly complex, and it's an incredibly stressful time for families. So there can be times when we're not communicating in a way that is effective, and now we're being trained to recognise it, to address it, so that we can all focus on the needs of the child.
The Evelina Resolution Project is the first project of its kind in a children's hospital to really be focused on supporting families and health professionals where there are situations of conflict or communication breakdown. So it's had two parts. One is a mediation service where we as independent mediators come in to support a family and a treating team if there is conflict between them. And the other part has been offering training in recognising the warning signs of conflict to mixed group of health professionals and giving them some really specific strategies in how to de-escalate and resolve situations.
And so with that, how does that make you feel? I'm actually feel a bit annoyed as well.
We're asking health professionals to step into the shoes of the families that they're treating. It's really switching that mindset from being professionals working within an institution and perhaps using the words that they use on an everyday basis, which they may understand and maybe the families don't, and thinking, what would it feel like to me if I was in that situation? Would I understand how I was being communicated with?
I think it's changed my practice. Where I work in intensive care, there's lots of difficult conversations that we have with parents, and as the medical team we go into those conversations and we have an idea of what we want to say, but we don't necessarily have time to think carefully about where the parents are coming from. So I think it was really valuable for me to think about those things and give people a bit of space to understand what I've said.
I think the training was very useful, and definitely I would say I use it on a daily basis in a way where we have a more open conversation with parents rather than a closed dialogue where we just make them yes or no questions. So I think it's good to sit down and think about these things and just put ourselves in families and carers and parents' shoes sometimes.
And equally recognise what they might be seeing in our parents and their families and the way they're behaving, which is not about them but about how they're feeling about their circumstances. We know that when conflict arises, that's a real danger, that the child is lost in everything. The main achievement has been supporting our staff and families to make sure we're putting the child at the centre of what we do.
The Evelina programme, I think, have been pace setters in how we can really deliver great mediation training, great communication training fundamentally to teams. And what's been so wonderful to see is the evidence of the difference it makes.
Listening, not responding and not being heard.
A different term which actually means the same thing.
Yes.
Getting communication with our patients and families right is absolutely critical. The time that we invest in achieving this upfront really does pay dividends.